Hi guys, my name is Dr. Jeremy Heidt with Pinnacle Chiropractic and Rehab in West Fargo with Research That Matters TV. Today our discussion is on opiates and opioids. What's the difference? Big tie-in to chiropractic and what we can do to help many people, especially dealing with chronic pain. To understand how this epidemic has happened, it's essential to understand the difference between opioids and opiates. Opiates describe drugs derived from the flowering opium poppy plant. Morphine is an example of an opiate. These drugs have been linked to physical dependence, increased tolerance, and addiction. Opioids are synthetic or made in the lab. When an opioid receptor in the brain becomes activated, they produce feelings of pleasure and not pain. All opioid drugs act on these receptors. Some are up to 50 times more powerful than heroin. Opioid drugs are used to treat pain, including oxycodone and hydrocodone. These drugs are highly addictive and dangerous. Oxycodone exhibits the highest risk of abuse and poses one of the most significant dangers. It affects the central nervous system in a very similar way to heroin. So, a couple key facts. Opioids can have a negative impact on your emotions, digestion, movement, and breathing. Fentanyl, a pain relieving opioid, is 100 times more potent than morphine, and opioids are highly addictive and not really meant to treat chronic pain. Current medical guidelines no longer recommend the use of opioids for spinal pain. If you're struggling for pain, movement-based care such as chiropractic is often the best way to accelerate the healing process and put yourselves in a position for long-term relief. Obviously, there's a time and a place for opiates and opioids, especially if we're dealing with different types of pain, especially acute pains. Chronic pain is one that if we can use a lot of these manual therapies, we can really get that healing process involved and really improve patients' functions long-term. If you're having issues with any of these issues, chronic pain, call us today. And if you want to explore a relief of pain that doesn't include medication or tries to limit medication, give us a call. We'd be happy to help. This is stuff that we do deal with very frequently. All right, have a good day.